Hey guys, this is welcome back to As Pharmacist Tish. I am your online personal pharmacist. I am so glad to see everyone. If you're not watching tonight, I look forward to seeing your comments in for the replay. So let's get into it. So today we are talking about mental health, and we are talking about in relationship to Kanye West. So we all been seeing on Twitter, on YouTube, on TV, how Kanye has, or Ye, that's his new legal name, Ye, has been acting and feeling pretty crazy. I'm gonna do like a breakdown of that and just in general in relationship to healthcare disparities in our healthcare system. I'm going to discuss mental health in the Black community or the minority community. So, once again, I appreciate everyone for checking me out. If you're watching a replay, please leave a comment and let me know what you think and what are your thoughts about the situation with Kanye. So, either way, um, first, we want to get into what is Black mental health. So we're gonna get into that. So it's a little different from relationship, from the typical mental health. But what is Black mental health? Black mental health is are the individual and collective experiences that influence the wellness of a community. So Black mental health is are rather the individual and collective experiences that influence the wellness of a community. So why is it so important? Thank you. Why is it so important to acknowledge healthcare disparities? Why is it so important to respect the fact that we all are different? We all have our culture adds in our own right, but the healthcare system, there are some prejudice against that. So let's just show a diagram that may show some um, relationship or bring perspective. So let's say we have a jumbo jet and just a regular airplane carrying over 200 people. Now imagine if those 200 people were on are Black and the plane crashed. 200 people can be on like a typical jumbo airplane to fly or whatever like that. So let's say it should crash, and every day a jumbo plane crash and 200 people die every single day. That is how many Black people or African Americans that are dying prematurely because of the unequal health care between Blacks and whites. 200 people. Now, if the airplane were to crash every single day, that would be a crisis. Even if a plane crashes once a week, that is a big crisis. 200 Black people are dying every single day because of the inequalities of healthcare prematurely. That is unacceptable. So that's why healthcare disparities are racial health disparities are so important because it is preventable, but no one is really honing in on it and taking care of a problem that's been created by this a system in America. And unfortunately, the system of racism has been very effective, and this is one of the outliers from that. So let's go into. So we're going to be talking about Kanye West. Let's look at him. He looks so sad, and unfortunately, he is one of the faces of mental health. But what's his deal? He has it all. He has money, he has access, he has it all when it comes to healthcare. But what is really the problem? What is really the underlying problem in the African American communities? So, with mental health in the Black communities, the underlying problem is trauma. Let me get to it. So, trauma is the biggest influencer of Black mental health. What are some examples of trauma? Well, you could start off with slavery. That that was pretty traumatic. A lot of people like to say, well, slavery is over. What's the big deal? Just move on, pull yourself up by the bootstrap and forget the past. But a lot of excuses or a lot of actual disease states like anxiety, stress, addiction is passed or predisposed because of genetics. So why cannot the trauma of slavery also be passed down from genetics through genetics rather? Because it's for a minority group, it shouldn't be brushed off. So slavery is definitely a trauma that the African American community has gone through. The Jim Crow era, I cannot imagine the stress of not knowing that someone may come and burn down your home, or the stress of your children can't even sleep in their beds at night because of the prejudices and the ignorance of 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 society protected by the government. um what else? You can't even go to church. You can't even walk down the street. And let's talk about the microaggressions. Just knowing in society that you're not really considered anything. You are definitely a second class citizen, and the society approves that. So, just that kind of stress will be passed down also genetically through, you know, causing issues for the long run from generation to generation. The civil rights movement, that's another, along with the Jim Crow era, just having to always fight just to be a human being, just to be seen as equal, a God given right. So that's another trauma in the African American community. This Tuskegee experiment, where Black men were told they were being treated for a syphilis and were lied to and were untreated just for scientific reasons, just to test, just to see whatever they can do with them. That is very traumatic. And because of that systematic experiment, the Tuskegee experiment, um, that's why Black people or minority groups, we have a distrust of the system. So going to the doctor and everything, especially when it comes to mental health, that is not something we are too quick to do because of experiments like the Tuskegee experiment, and just many, many more. Just many more. Um, when it comes to mental health, 1 in 4 Americans suffer from a diagnosable mental disorder. Minority populations are less likely to receive diagnosis for their behavioral health issues and have less access to mental health services. So, minority populations are less likely to receive a diagnosis for their health conditions. We see that all the time in the school system. You may have a little Black, boy, and because the environment he may have come from, or maybe just in general, he can come from a good home, but because he is not acting in a way that's pleasing to the teachers, a lot of times he may be seen as a problem. Whereas another child, a white child, can be having the same behavioral issues, or probably not even an issue or anything like that. But he is seen as, oh, he needs more work. He needs to be looked upon as he's so brilliant that he is acting out. So those are two things that is a big deal when it comes to mental health in our communities. So let's see here. So, for example, let me show this because this clip, it just breaks my heart, and just show how this young man, Elijah McCain, and he even called himself an introvert, and because he was not just a Black person, a young Black man walking down the street, he was seen as a threat. So imagine every day if you're a Black person and you can't even walk down the street without having some kind of issue or just not knowing you may come home. So let me just show this clip. And this is a prime example how the Black communities have to deal with the underlying trauma for mental health.
Hey, stop right there. Stop. 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 I have a right to stop you because you're being suspicious.
Well, okay.
Turn around.
No,
Turn
I
around.
see your hands, bro.
Turn around.
Stop.
Stop. Stop tensing up, dude. Stop tensing up, bro. Stop tensing up.
Let
This isn't gonna go
go
well,
of
dude.
me.
Stop tensing up.
911, what is the address of the emergency?
So there's a guy, he's walking south on Billing Street, and he has a mask on. He looks sketchy. He might be
Okay.
a good person or a bad person.
Yeah.
Chill out.
No, I am an introvert. Please respect the boundaries that I am speaking.
Relax.
Stop. I'm going home.
Relax, or I'm going to have to
Leave
change
me
this
alone.
situation, dude.
You guys intend to take my power back, and I intend to be
Come on with him, okay?
centered. No, I intend to be centered.
Grab your gun, dude.
Stop, dude.
Stop.
Okay. A good person, stop.
Okay. All right, side.
I'm gonna
straddle him,
figure four his legs.
Recovery position. Trust me. Recovery. I have his legs.
I have no ID. Right here.
He's my body.
I have no ID.
It's under 18. You got him.
He's
Still fighting us in the ground.
My name's Elijah McLean.
Yeah,
That's
but
all.
we had to use carotids.
That's what I was doing. I was just going home. Why? I'm an introvert and I'm different.
If you keep messing around, I'm gonna bring my dog out. He's gonna dog bite you. You understand me? Keep messing around.
So when the ambulance gets here, we're going to go ahead and give him
All
some
the cops are
ketamine.
okay.
Yep, sounds good.
Perfect, dude. Perfect. He's drawing up ketamine right now.
Okay.
You want to give that before we...
Yeah. So once he gets out, y'all going to hit him in the right shoulder.
You want some shit?
Everybody's good.
So that was a prime example of the underlying trauma in the African American communities and how oh, thank you. Thank you. So sorry about that. The beauty of lives, sometimes things just go wrong. But either way, thank you for fixing that for me. So that was a prime example of how things in the African American community, how just walking while black, this living while black is a public health crisis. And all of that causes stress, all of that, the mental health of it, it can lead to stress and early death. And like I said before, 200 people, black people die every day because of on because they are not treated in the same respect as our white counterparts. So back to Kanye West. What is his deal? So that um he is diagnosed with bipolar disorder. I think, in my personal opinion, that he has a little bit more going on than a bipolar disorder. Of course, I'm not in a position to, um, I'm not his pharmacist. I don't know anything about his medications. I'm definitely not a medical doctor, so I'm not, diagnosing him. But this is what's been said in the media. So bipolar disorder is a mental health condition that causes extreme shifts in mood, energy, and behavior. People with bipolar disorder experience both dramatic highs and called manic episodes and lows called depressive episodes. These episodes can last from weeks to hours, from weeks, and many have no time in between episodes. So, but what is really Kanye West's issue? In my personal professional opinion, his issue is the death of his mother, the underlying trauma of or the unresolved trauma of the sudden death of his mother. His mother, Donda, died from what the media is saying because of a surgery that went wrong, a plastic surgery that went wrong. And from that point on, Kanye West has never been the same. But at the same time, with his recent antics and stuff of that nature, a lot of people are saying, that maybe it's because he has an album that's coming up in another 2 weeks, Donda 2 that's coming out in the next couple of weeks. But I don't believe, Kanye to be a vicious person and would torture and, humiliate his family, his children at least, because of an album release. So but we all seen it played out after his mother passed. He has been going through a lot of different episodes, and I agree. I do would say that he has a manic, goes through a lot of manic highs, a lot of depressive lows. So him being bipolar is pretty much on point, but it really doesn't matter what the issue is or the diagnosis if you don't get to the underlying problem. That's the thing with mental health. You have to get to the underlying problem. You have to recognize it. It has to be treated before you can build up and go to the next diagnosis and treat that. So it's like putting a band-aid over a problem without trying to kill the infection and get to the root of the issue first. So he has, I would say, a lot of unhealthy grieving, and he's not talking about his problems in a healthy way, and he's just not he's just not doing the work. I'm not sure if he doesn't wanna do the work. I'm not sure if he's not recognizing that he's not in a healthy place and that his mother, the death of his mother, which is, of course, grief, it depends on the person, and no one can put a time frame on how long someone should grieve, especially for when it's a loved one. But the way he is handling the grief is highly unhealthy and is deteriorating every part of his life. He just lost his wife. He has 4 children. He's being very manic, which is a symptom of the bipolar disease state, and his children, what to make of them? Like, it's already an issue where genetically this disease state can be passed down genetically, but just to see your father acting out in public and humiliating the mother, that's some deep-seated underlining trauma because it just doesn't make sense. So that's why it's just so important to recognize mental health, to recognize the health disparities that comes when it comes with the different health with the different, population groups. Because from the video of Elijah McCain, he was given ketamine. So, cops in Colorado, where this taking place, have the right to basically prescribe with the paramedics to give a certain person, or assailant or whoever they see as a threat, ketamine, which is a very powerful sedative. So, what are the odds of African American person seen as overly aggressive to receive such, and he had a heart attack on the way to the hospital. So I obviously they didn't know his dose. They didn't know what medications he could have been on. They didn't know anything. All they knew that he was a black person. He even said he's an introvert, so that may be his way of saying, "Hey, I already have a mental health issue." I'm not sure, but that's what his he was I've heard that from reading articles and stuff that he was very much an introvert and had his own set of mental health issues from to begin with. So it wasn't really their place to give him ketamine, and unfortunately, he lost his life. So, yeah. So on that, we just have to be very into taking care of our, community and our mental health needs. So, now anytime if anyone have any questions, please let me know because that's what I am here for. We have another statistic that says Black Americans are 20% more likely to experience serious mental health problems than the general populations. 20% more. And that's just for the reasons that I stated, starting back from the slavery. A lot of people may find that to be an excuse, but genetically, that kind of stress can be passed down from generation to generation, and it does show itself. 20% more are in the regular population. But are we getting served when we go to the doctors, will we even mention it? And that's because we won't because there is a distrust with the healthcare system because of the Tuskegee experiment, is distrust of the, community in general, when it comes to our care. So, and we're so used to, excuse me, we are so used to n bottling things up and not acknowledging that we have issues. So, we need to be more aware that we need to be taken care of as well, and we need to have more access to care to be able to do that. So how can someone like me help out in a process like that? So, a lot of times from my experience, a lot of people are afraid of medications especially when it comes to the psychotropic medications or any of these kind of medication that helps with stress, when it comes to anxiety, when it comes to depression. And my thing is with that, especially with the environment that people come from, that can cause an automatic shift in the serotonin or the neurotransmitters that are supposed to be balanced in our brain. So that's why a lot of times medications are needed. But I like to reassure people, because you are on medications or if the doctor should prescribe you a medication, a lot of times it's just needed to get you what I call over the hump. You don't need it for a long-term use. You don't have to think about taking it forever. Just take it day by day, but do take it to get help with your mental health needs. And it would be a dramatic just amazing when you can get evened out with your mental health. When you're feeling better, then things will dramatically improve. But a lot of times people are very, very afraid of taking medications because they feel like it's going to change the way they think. They're afraid of it's going to maybe make them gain weight. They feel like they're gonna be a totally different person. It's the medication, it's not a lobotomy or anything like that. So, a lot of times medications that are given in Kanye's West case, like I said, I'm not his pharmacist. I'm not sure what medications he's on, if any. From what I'm reading, he is not on any medications. And a lot of times, especially people who are artistic, they do not take medications because they feel like it's going to impede on their artistic gift. It's going to impede on the way they think and how artistic they can be, and how they can. In Kanye West's case, how he can flow, with his lyrics and his words and his thoughts, and the way he designed clothing. So I'm pretty sure that's the main reason, but it really doesn't matter. In my personal opinion, it really doesn't matter if he were to be on medications or not for his bipolar, because his underlying issue is the death of his mother. And until he talked to a psychiatrist or a psychologist, or just talk to someone who's a professional mental health therapist who can address that issue and speak with him, then it really doesn't matter, in my professional opinion. Just from what I've seen in my profession, over 20 years as being a pharmacist, it just really doesn't matter. So these are some of the medications, and this is for informational purposes if you're interested. A lot of times, there's a group of drugs called antipsychotics, and it doesn't mean you're psychotic, but it is what we call in the pharmacy a psychotropic agent to help with, the mindset and to get the neurotransmitters like the serotonin, the dopamine, to get everything balanced, the GABA, all of that balanced in the brain. So some examples are olanzapine, or the name brand Zyprexa, the risperidone or Risperdal. A lot of people also take that to help them rest. And that's another thing that Kanye West tried to blame, that he's not bipolar, but he's saying he's actually tired because he's not sleeping well. But and that could be true as well, but it really doesn't matter unless you take care of the underlying problem. Quetiapine or Seroquel, the Piprazole or Abilify, the Geodon, the Latuda, the Saffris. These are all medications a lot of people who it gives like a calming effect for bipolar disorder. Um, this is the mood stabilizers, and this is a lot of times in conjunction with the the bipolar medications, the antipsychotics to help even out like I said, the neurotransmitters. And what I mean by neurotransmitters, those are the natural substances in the brain that helps with the balance of how we think, how we have self-control, how we function. So like lithium is used as a mood stabilizer. Something I wouldn't think Kanye West would need. He it just wouldn't matter with him. Valproic acid, Depakote, carbamazepine, and lamotrigine. And a lot of people, these are actually very popular medications. And from my experience, I've seen a lot when it comes to psychotropic agents, when it comes to mental health, from the almost 30 years I've worked as in the pharmacy field, not as a pharmacist, but in the pharmacy field. I've I've seen the white population group, they have no problems with addressing their mental health issues. Or is it that the providers have no problem with being open to discuss that there is a mental health issue? So it's like the chicken or the egg, how does it work? But either way, the issue is being worked out and resolved. I see very, very few of the African Americans, of the Hispanics, even the Asians. When you think about it, I don't ever really remember thinking, have I ever seen an Asian on any kind of medications for that's a good thought. I'm sorry, I had a little epiphany while I was, doing this. But we have no the Caucasian, communities, they have no issue with that, and they are thriving and they are functioning well. We are very resilient. We are we can do anything, but imagine how much more we can resolve and get done, how much more our life can be better if we were to open up and take a hold of our own health care, especially our mental health. How much better can we be and how much more function, how much more we can bring to our own communities if we were to get mental health straightened out. So, but like I said, it's not something that you have to see as for the rest of your life. You don't have to see taking medications as something to hold you back. It's something to promote the self, your healthiest self, to make the best out of you. So it's very good that a pharmacist, we are here to discuss such medications with you. When it comes to, and I'm really big into lifestyle modifications. So I know there was a issue where I had this older lady, she was in her 70s, and she was on a ton like 3 or 4 high blood pressure medications, okay? So 3 or 4 high blood pressure medications. She was, like I said, in her late 70s, and she was with her daughter. So by the time I see that she was about to be on her 4th high blood pressure medication, I'm like, "This doesn't make sense," because I see her with her daughter. I see that she's adherent or compliant. So what can possibly be the problem? So taking time to discuss with her. I asked, "Well, what's going on in your life? Are you taking your medications?" You have to ask. She says she is, but I already knew the answer because I can see from the computer system that she is. Um, so, so I asked, "What's going on in your life?" She said, "Oh, nothing." I said, "So you sure no life changes or anything of that nature?" She said, "No." Her daughter who was with her while I was giving the consultation said, "Mom, dad just died like a few months back." So this older woman who is on 4 blood pressure medications, she had such a deep-seated trauma or unresolved, dealing with grief to the point she bottled it down and forgot to even think to mention that her husband died. Just like it was no more than like 6 months prior. So from that, I talked to her and I was like, I don't think blood pressure is your issue. Your issue is you have a lot of stress and anxiety and you're not acknowledging it. And you just need to get on some short term. You have to kind of ease them into it. Some short-term antidepressant or some kind of short-term anti-anxiety agent to kind of get you back on track because otherwise the unresolved stress is spiking your blood pressure. And how many more blood pressure medications is your doctor going to put you on? So, from that being said, she went to her doctor. She discussed it with him. I see a new prescription for a new antidepressant or anti-anxiety medication, and guess who was down to one blood pressure medication. So a lot of times, unresolved issues can manifest, and a lot of time it does manifest into high blood pressure, something that can, or stroke or stress. And that's what happening, in the African American communities because of all the undercurrent stress and the trauma and the depression and all of the things that are going on. That is what's causing us to die at an earlier rate. That is what's causing us 200 over 200 of us to die every day because there are people like I hate to say, in this case, me, or other doctors who are willing to take a deeper look, to really dig in to see what's going on. So that can be the beauty of your healthcare professional or your pharmacist. So, with that being said, there's really no excuse and I'm gonna say this on every live, because I made it clear on the last live that there is a pharmacy on every corner in the United States because drugs are a big business, because the big pharma always pumping out a lot of drugs. The benefit of that is that there is a pharmacy to house all these medications to sell to the consumer or to the patients. So there's really no excuse to not, and pharmacists we are a free resource. You can walk up to the counter and there is no money to be spent just to talk to a pharmacist. There is no money. Now there's money to get your prescriptions, there are money to, buy supplies or whatever or whatnot you need for like diabetes or whatever the case may be. But if you just need a consultation to get a bearings on your health, that is a free resource. And there are tons of pharmacists that are willing and able to do that for free. And if you need an expansion of that care, then that's when we can really dig in. If you find a really caring and good pharmacist, that's when we can dig in and do that extra work for you. A lot of times I have called doctors to make recommendations on behalf of patients or pull, connect the dots for the patients when they are so confused or so boggled with the mindset of like, how do I even get this process started? A pharmacist is a free and really good resource to get that done for you. So even when it comes to mental health, mental health medications, they can be very complicated and there, I will admit there are a lot of side effects, but a pharmacist can help navigate that process for you. And a lot of times we can, I give advice all the time on, maybe you should start with this medication versus that medication. Just a lot of times when you have that relationship and you have access to the backstory of the patient, you kind of have a knowing. And when you take care of a patient like you would take care of your mother or your father or your own child, when you have that kind of caring wisdom, that's when you can get the best out of a consultation with your healthcare provider, especially a pharmacist, and is free. So I had another incident where I have a family member who has a child that is autistic. And of course, with him being a teenager, he was going through he's yes, he's autistic, but he's still a a child. He's still going to be a teenager. And with all teenagers, they get highly aggressive. They get, you know, they just want to talk back but when you're an autistic teenager, you're not going to do the typical attitude possibly or the talking back possibly, but it's going to show itself. So instead of treating this child like an autistic person or a teenager and loading him up on tons of medication, I warned her. I said, "Listen, what they're gonna try to do, they're not gonna acknowledge that your child is a teenager. They just gonna start the process of having them on 3, 4, 5, 6 medications, especially with him being a minority. They just gonna load him down just to keep him drowsy so he cannot be an issue instead of him being a teenager, and the way he communicates and the way he reacts is just that's how he does because he's a teenager." So I'll answer your question in a minute, Teacher Chronicles. Thank you. I'm up here struggling. But either way, so sure enough, the doctor, my family member went to the doctor with a teenage child, and sure enough, like I told her, they tried to start off the gate with three antipsychotic medications for one teenage 13-year-old child. So, because she had a pharmacist in the family who was able to talk to her and warn her and to be able to have control of her child's health care, she was able to be empowered and started off with one medication, and that was all he needed. That was it. One medication that worked. Now, they did go through a couple of trials with other medications and everything of that nature, but they started off with one and they found the one that works versus having him on 2, 3, 4 medications, and he's so doped up, I hate to say, under the influence of side effects of the drowsiness and the disorientation that especially when a lot of medications can cause at one time when not no care is involved, and not be able to be a child that can enjoy their early years. And because he's autistic, that doesn't mean that he can enjoy his life and just be a typical teenager. So Teacher Chronicles asks, "Can I drink alcohol while taking antidepressants?" That's a great question. So because you're taking an antidepressant or an anti-anxiety agent, that doesn't mean that your life is over. It doesn't mean that your life has to suck. It doesn't mean any of that. I still tell the patients I deal with, you still can enjoy your life. So with that being said, yes, you can still drink. Now, when it comes to being responsible and talking about lifestyle modifications, of course, you want to do everything in moderation. So I'm not saying get wasted and then take your Prozac or get wasted and take your lithium or no, we're not talking about. I'm sure we're just speaking about typical drinking, a glass of wine, drinking a beer, or something like that. But the only catch is, it does depend on the medication. But a lot of times, if you just separate you have the medication out by a couple of hours from the glass of wine or the 2 glasses of wine that you desire to drink, or if you wanna drink a few beers or whatnot, just make sure and separate it out by a couple of hours, and that will give it enough time where it won't be a issue with the 2 together. So that's a very good question, I appreciate that. And with that being said, it is about time for the question corner, but definitely on the replay, if there are any questions or anything, leave it in the comment section. Thank you, Teacher Chronicle. Leave it on a replay, and I will definitely get back with you and answer it. If you desire to have more of a HIPAA privacy, just communicate with me. My all of my information is in the bio section or about page section, and I will get back to you, and we can do like a private HIPAA protected informational consult. I have heard that there may be negative effects associated with stopping antidepressants. Is that true? Yeah, so that's a really, really good question, actually. What Teacher Chronicles is referring to, a lot of times if you suddenly stop taking antidepressants or any of the what we call psychotropic medications, that it can have bad side effects like withdrawal. And there are some medications that we have to do like a wean down process. So usually, you don't want to stop, like let's say you don't want to stop a Prozac or a Lexapro or lithium or whatever the kind of medication you're taking. You don't want to just stop it like cold turkey because you will have an imbalance of chemicals, the neurotransmitters in your brain. Like I said, the serotonin is going to be out of whack. Your dopamine is going to be at an all-time low, and you're going to just be like, "Oh my God, what is happening to me?" Now, it will level off, but the best thing to do and to keep you from feeling and acting more crazy than you already would if you used to stop cold turkey is to do a wean down process, and definitely your medical doctor will give advice on how they want it done because it depends on the medication and it depends on what the therapy that is being done. But a lot of times, I hate to say, I have seen where doctors, where it may not be even the doctor's fault, actually. I'm going to take that back. I see where the patients just decide that, they don't like something, they don't like the side effects, or they just feel like the number one thing is they feel like they don't need it anymore. That's the number one no with psychotropic agents rather. You take it and you start to feel normal, which what is the medication supposed to do, and then all of a sudden you just stop taking it, and then you wonder why, you're going through, the darkness of life, so a lot of times a pharmacist, can help with that. So I can't blame the doctor for not doing their job on that. A lot of times patients just stop, the doctor has no clue, or sometimes the doctor does have a clue and they just like to say stop or whatever. Just depends on what the relationship is going on or where their mind is. And the patient is they're tweaking. I hate to that's the only word I can put. They are tweaking, they are having difficulty with work, they are snapping at the children, they're shrieking, they are going bonkers because they have not done the proper wean down process of or just stopping antidepressants or anti-anxiety out the blue. But usually that's the worst case scenario. It may be like a few instances or medications where, if you stop too soon, you may have like a seizure or something like that. That's rare. But the main thing is you want to be consistent when you're taking your mental health medications. And the main thing is, and the whole premise of this conversations today is to bring awareness to the African American communities that first you have to identify there is a problem to solve the problem, and we need to recognize that we do have an underlying trauma, and it's not an excuse. We have an underlying trauma in our communities. Um, Everything is usually is some kind of underlining issue, and you have to address that and attack that first before you can go on and do something. Before you can go on to take care of the symptoms. With Kanye West, his acting out is the symptom of the problem. His actual problem is in my professional opinion, is the death of his mother, and he's not grieving properly. He has probably not talked to anyone about it, and he's just basically not addressing the fact that his mother is not here, and he needs to heal and to be, grieve properly and not have all these manic episodes and acting out because of the enormous amount of grief that he's suffering from. So just as a community, we need to recognize and understand it's not an excuse that we have gone through generation of underlining issues. This can be passed down from, like I said, generation to generation, and that can be, while we automatically, when we sleep at night, our stress levels are to go down. With the white communities, their levels are normal for what it's supposed to be in the evening time, whereas the African American communities, from statistics and testing, hours go down just slightly. So we stay in flight and fight mode. We stay on edge. And unfortunately, it's from the system, a systematic reason. And it is what it is. But what are we going to do about it? Can someone become addicted to antidepressants? No. Um, Antidepressants aren't addictive, but what can be addictive are like the anti-anxiety agents, something like Xanax, um, other stuff of that nature can be highly addictive. But if you just do how you're supposed to take it, then it will be fine. But no, antidepressants aren't addictive. And I will be the first to say a lot of times the very first antidepressant that you are prescribed is probably not going to be the one that's going to work for you. So you have to want to have proper mental health care before you get the process started. If you already come in with a negative attitude or attitude of you don't care if you get well, or if you're not confident that there is a solution for your depression, there's not a solution for your anxiety, then it's not going to work. So that is a good question. So no to the antidepressants, but when it comes to the anti-anxiety agents, there is a possibility. You're welcome. There is a possibility that can cause an issue with addiction, but that's only if you're under the care of your doctor. And pharmacists, we are pretty good at keeping up with. Um, we're pretty good with keeping up with making sure everything is filled at a proper time. So you have to these days of time you have to work really hard to get an addiction going, and go from that route because there is hey, Trash Can Waves, how you doing? So yes, let's see. I'm about to tell your boss. You better not. How you know? How you know she's the boss? Yeah. Trash Can Waves, do you have any questions about mental health? How do you feel about black men and mental health? Do you think that y'all take care of y'all mental health the way y'all should? What do you think about like Kanye West and how is he handling his mental health? So that's what we were talking about today. I guess he probably went to tell the boss really quickly. Um, yeah, but how do you feel about mental health in our African American communities? And how do you think it can be better or whatnot? So, like I said, to kind of bring it to a close, um, there's really no excuse. It's just there's no such thing as you know lack of accessibility or knowledge or how to go about things when it comes to navigating the medical field or the medical system. Let me see. I think there's too much coddling, and we need to toughen up like the older generation. Wow. Okay. Well, that's how do I feel about that? Is there too much coddling, and do we need to toughen up? In some aspects, I do believe that, but what do you think about the passing down of generation of trauma? Like I mentioned earlier, from the slavery to start with, the let me see, personal opinion. Yeah, I got you. Yeah, I appreciate that. Great point. Teacher Chronicles flipping a little bit. Personal opinion. Yeah, I mean, well, how do you feel about the the trauma that's passed down from? Do you believe that trauma has been passed down from generation to generation genetically? Do you think that it's possible to genetically have uh, the stress, the underlying trauma, just walking as a black man, just walking down the street, um, that can pose an issue. I mean, you probably don't recognize it, but there is going to be a burden of underlining stress from just never knowing how you may be perceived or whatnot. So, But I mean, I believe that too. I mean, I'm definitely not one to want to make excuses. You know, I'm definitely the one that, you know, do what you got to do what you need to do. There's really no excuses for it. But I'm also having that more gears towards is no excuse to not get the health care you need because I have made clear that there is a pharmacist on every corner. You see, I believe if we keep allowing ourselves to use trauma of the previous generation time after time repeating as a crutch, we will never take a step forward. Yeah, but a lot of times when there is a okay, so you have to recognize there is an issue. Before you can solve a problem, you have to know that there what the issue is. And once you know what the issue is, then you can solve the problem. So a lot of times, you know, we are walking around with the trauma from generation to generation. It can be passed on genetically. I mean, like alcoholism and addiction, and you know, mental health. It can be passed down from generation genetically, rather. So, you know, if other groups of people are open to understanding that and going accordingly, why should we be any different? Why we always have to be so tough, and why do we always have to, you know, not have anything to recognize that there is a problem to move forward? At a certain point, a generation has to stand and say, "The past is the past, and it doesn't make me and it won't break me." Yeah, and that would be good if things have changed somewhat. I mean, things have greatly changed. I will say that, but I mean, but we are in a good position where, you know, we probably don't have to deal with a lot of the trauma from generation to generation. But a lot of people that are in poverty, they have to still deal with that. That's true. But in my experience, once the blaming problems start and are granted solutions, they're soon followed by more problems and excuses. I give you that. I would agree with that. I mean, it's always gonna be a problem, there's always gonna be a solution, but when it comes to health, it shows itself, with how we it does show itself. We Every other group besides Asians, because I am just noticing that I have not really, done any medications of all the years of my pharmacy career. I can't really think of I can't think of 5. So I would love to talk to some Asians about that. What are they doing? But I'm gonna try to find one to interview, and we can discuss it. And maybe they have, you know what, but they don't have that underlying trauma either, though. And then if they do have trauma, you know, our government usually takes care of them and make it okay. A lot of times when things aren't acknowledged, and it is in you know, just like slavery, a lot of people don't wanna acknowledge that. People, you know, in the medical fields, it is taught in medical schools that Black people have a higher pain threshold than our Caucasian counterparts. Okay, this is being taught, and that is manifested through what does that mean? What the odds mean? And that is manifested through the you know, not getting the pain medications that we need. You know, all this underlying stress and trauma, that all is just not about not feeling good and being happy or having a bad day. It manifests mental health manifests into, and I gave an example how it manifests into high blood pressure, into strokes. We can we can be it doesn't even matter if we're educated, it doesn't matter to the amount of money we make to our white counterparts. We can make the same amount of money, we can have the same amount of education, but we will still die years before our Caucasian counterparts because of the underlining of racism, of health disparities. So, you see, government, source of all problems, government also pose as the solution for all the problems they created. Yeah, but that's how you do it. That's when you're a gangster. You know, you cause the problems, and then you're like, "Oh, let me come in and save the day." But that's more for black light revelations, though. You know, I can't get too deep. Yeah, so I mean, so trash can wait. So what? So you don't think there's a such thing as black mental health issues? You just think you don't believe in mental health, or like what is your or you think as a population group we're just too whiny, or like what is um your say on that? We die sooner because we love pork chitlins, rib salt, and watch soap. Actually, that's not true. I mean, that and okay, let's just go there. Okay, no, no, it is racism. There are studies out there, and I can pull it up at another time. There are studies that show when we're on the same wavelength when it comes to education, when it, lifestyle, social economic, that we die so years before our white counterparts. And that's because of all the microaggressions, all the, there are people, there are men, if they just want to go out and get a gallon of milk, they feel like they have to put on a suit and a tie just to get a gallon of milk. So they feel like they are their best chances of coming home without being harassed if they have to go out just to get something simple as a gallon of milk at night. If something is an emergency and they need something. So all of that, think about the kind of stress that is to have to think that way. And if you already thinking that way and you have a solution for it, you still is that undercurrent stress, that cortisol level that goes up to create all of this. So it actually is racism is a public health issue, and it does really make us sick. I'm not making an excuse because, I've done what I had to do and I'm where I am. And I didn't make any excuse to do it. I mean, I had to go through a whole lot of crap, a whole lot more crap to get to where I am. I mean, I've went to school in Charleston, South Carolina, and it was everything you think it would be, being a black pharmacist student in Charleston, South Carolina. But I did what I had to do, but it was highly stressful. Um, you see, I believe statistically ratio wise, there shouldn't be as many people with mental health issues as they are. Yes, mental health exists. I have a cousin with Down syndrome, but it is as bad as, okay, I'm not sure what all that's saying. Government wants us to believe we are a failed species. Right. Yeah, I mean, they will like that. So that's why we need to kind of huddle up, go to people that we can trust. And sometimes you just can't do it all on your own. So that's why I was saying, there is I guess it's time for me to end my live because my dog is like telling me it's time to go. But there is, um, resources. The main thing is provision of care and access to care that's causing the health disparities. Do you think there are racial health disparities in medicine and healthcare? But the provision of healthcare, the way it's provided, and the access are the two main issues that's causing the healthcare disparities. Access, I wanna clean out because pharmacists thank you. Pharmacists, are highly accessible and we're free. We are a free resource, and there's really no excuse, for there to be any issue with access. Even with provision of care, a lot of times we know who the doctors are, we know who are the good ones, we know who are the bad ones, and if you just take time to just I have patients that ask me all the time, who is a good doctor? What should I go to? And I have my list of my roster of doctors that I'm like, this doctor is going to take care of you. And it's not like they all black all the time. There are a lot of white doctors, that I recommend as well. Let's see, question. Let's say you perfectly sane and day in day in and day out. I come and tell you you are crazy as well as everyone else. How long before you start to accept others' outlook on your mental health to be true? I don't know. I have people tell me I'm crazy all the time, so I really don't care. I'm not sure what your point is, but I'm just joking. But I see what you're saying. If someone keeps telling you something, then you start to believe it. But if you already have a chink in your armor, then you're gonna be open to that. So that's why we need to have more accountability have more self care on taking care of ourselves because that's just something we always gonna have to deal with. That's just everyone across the board. If you tell anyone anything, that's just how it's gonna be. But if you are empowered with information, if you're empowered with community, if you're empowered with people that you can trust and fall back on, and I hate to say, as a African American group, like, a lot of the, Hispanics, they know they have their own communities to take care of each other, the Asians, the white people, but as Black people, we're a little more fragmented, and so that's the beauty of what I want to offer to this online community is I'm the person that you can come to. I'm the pharmacist that you can come to. I'm the healthcare professional that's gonna have your back and look after you. Not just for the Black people, but I'm a Black woman. I love my Black people, and I feel like I can really bring a service um, to the community. So, mental fortitude X. Okay. Any other questions or anything? So, I was gonna head out. I appreciate everyone. I appreciate you, Trash Can Ways, and don't worry, the boss will be back soon. And don't tell her, please. I'm just joking. She knows. She should know. Feature Chronicles. I appreciate great questions. I appreciate your support. Trash Can Ways. I appreciate the support, and we're just getting started. So, sorry, I'm a little unnerved, but I'll get more comfortable and we're going to have fun and we're going to be informative at the same time. And we're just going to really help each other out and we're going to grow and we're going to be our healthiest self. That's the main thing. I want everyone to be happy and as glowing as I am. So, and that's because my mental health is in check today. So, either way, I appreciate everyone watching. I appreciate y'all guys, and I'll see you on the next one. Take care. Remember to like, share, and subscribe. Take care. Bye.